Hello, my name is John Ziering, and today my topic is going to be about the importance of vaccinations in the United States to prevent outbreaks of deadly diseases such as the measles. You may wonder why it's so important to vaccinate and why I'm advocating for such a cause. Vaccinations are a crucial and highly successful health measure that prevents outbreaks of a number of diseases worldwide each year. Before immunizations, thousands of people died from diseases such as the measles, the whooping cough, rubella, and polio, all of which are preventable with immunizations. Rates of these diseases declined until today. Most of them are nearly gone from our country. Breakthrough outbreaks of preventable diseases such as the measles in the United States often occur because of vaccination misinformation. This campaign aims to spread the facts about vaccinations and eliminate the misinformation that causes certain U.S. communities to resist childhood and adult vaccinations. You may have heard of outbreaks such as the 2015 Disneyland measles outbreak, where there were over 100 cases of the measles. There have also been a number of outbreaks in other communities where vaccination levels were very low. In 2014, the United States had 23 measles outbreaks, including one with 383 cases. This happened mostly in an unvaccinated Amish community in Ohio and were brought in by the Philippines. This is not only an issue of the past, there are more reported outbreaks this year in 2018 as well. There are a number of reasons why people choose not to vaccinate, and most, if not all of these, have been scientifically disproven. Proponents of the anti-vaccination movement have claimed a link to autism, that they cause serious health problems, that they are not effective, but this is simply not the case. First, a link to autism was linked to a piece called the Wakefield paper, which is later redacted. Many outbreaks of disease have been led to this false information in unvaccinated communities. According to the CDC, there have been many studies and no relationship exists between vaccination, the ingredients in vaccinations, and autism. A CDC study added to the research showing that vaccines do not cause autism. The study looked at the number of antigens, substances in vaccines that cause the body's immune system to produce disease-fighting antibodies from vaccines during the first 2 years of life. The results showed that the total amount of antigen from vaccines received was the same between children with Asperger's and autism spectrum diseases and those that did not have ASD. Another piece of false information is the idea that vaccines cause health problems. Concern over the danger of vaccinations have repeatedly resurfaced in the mid-1970s after a report stating that 36 children had suffered serious neurological conditions following DPT or pertussis vaccinations. Coverage in the UK declined from 77 to 33%, and as a result, 3 major epidemics of pertussis broke out with over 100,000 cases. Vaccines are designed to prevent illness and are made as safe as possible. The Food and Drug Administration requires extensive research and testing before allowing a vaccine to be licensed for general use. It goes through extensive testing, and a number of clinical trials are conducted before even receiving an FDA license. As an example, the measles, the side effects are as follows for a vaccination. These are the possible side effects. So you might have a mild fever, 1 in 6, a mild rash, 1 in 20, swelling of glands, about 1 in 30,000, severe, very rare, serious allergic reaction, less than 1 out of a million deafness, seizures, coma, permanent brain damage. These are so rare that it is hard to tell whether they are caused by the vaccine. That's what the CDC said in 2017. Measles side effects. There are many complications to the measles. 6 to 20% of people who get the disease will get an ear infection, diarrhea, or even pneumonia. 1 out of 1,000 people with measles will develop inflammation of the brain, and about 1 out of 1,000 will die. Again, the CDC said that potential for spread to others is really high. Whereas some vaccinations do have some minor side effects in comparison to the disease, it is aiming to prevent the side effects are minor and worth the risk. The government is luckily we already have state legislation on our side in terms of vaccinations. There are currently 15 bills surrounding vaccine administration, and because of measles outbreaks, legislation is already considering bills to improve vaccination rates and reduce the risk for students in college living in dorms. 2 current bills are requiring proof of vaccination before enrollment. In 2017, the bills surrounding tax consequences, administration requirements, removing exemptions, and adding more exemptions have been put in place, as our government is supportive of strong vaccination laws to prevent disease outbreaks. Finally, a bill introduced in New York would disallow parents who received a non-medical vaccine exemption for their children from claiming a state child tax credit. The credit would instead fund the health department vaccine programs and activities. The biggest problem in terms of vaccination rates and disease outbreak is the spread of misinformation, mostly through social media and Google. It is of vital importance that pro-vaccination movement be made loud and clear. This would be done through a strong online and social media campaign using the hashtag #VaccinationSaveLives or preventable diseases. The major goal of this advocacy campaign is to spread the message about how important vaccines are and to debunk the myths that they cause harm. Because every advocacy campaign needs partners, the strongest advocates for vaccines are parents and nurses. I would partner with organizations such as the CDC and the World Health Organization, who Sabine Vaccine Institutions, Immunization Alliance, Voices for Vaccines, UNICEF, and more. I would ask these companies to support either through messaging or financially our advocacy campaign. To close, I want to tell you about a family that has been affected by the myths of the anti-vaccine campaign. Meet 10-month-old Eli. He is showing signs of the measles after coming into contact with an unvaccinated patient while staying with her 3-year-old sister that is fighting leukemia. Eli is getting sick as he is too young to be vaccinated. His sister cannot be vaccinated because of her disease. If her sister gets it, she can have major complications, including death. A note from her father states, "Towards you, unvaccinating parents, I feel anger and frustration at your choices," wrote Jax, a pediatrician. "Why would you knowingly expose anyone to your sick, unvaccinated child after recently visiting Disneyland?" That was a boneheaded move. Vaccinations are crucial to preventing the spread of a number of diseases. As vaccination rates drop, the likelihood for outbreak increases substantially. This is called herd immunity. By everyone getting vaccinated, this produces indirect protection for the community. Certain individuals in the population are at risk if we are able to choose to be immunized. Children, those who are truly allergic to vaccines or are immunocompromised, these people are at risk and can die if exposed to the illness.